Afternoon, and welcome to Stony Brook University Hospital's Burn Center Burn Awareness live stream. I'm Dr. Stephen Sandoval, the Medical Director of the Burn Center here at Stony Brook. I'd like to welcome you to our live stream to discuss issues with burn at Stony Brook and how we manage these patients. We have here with us also some experts in our field. The first I'd like to introduce is Norman Cruz. He is one of our nurse practitioners here in the Burn Center, and he is instrumental in helping both the Burn Center and the Burn Clinic function smoothly. And I'd like to first introduce Norman. And Norman would like to say hello.
Hello, everyone. Nice to meet you.
And also, I'd like to introduce some of the nurses that we have in the burn center itself. And without them, we wouldn't be able to take care of the patients the way we do. They're instrumental in doing the day-to-day care that really makes a difference for the ultimate response to the care that we provide. And they're the ones that are there at the bedside constantly. And I'm really pleased to introduce first Benita Horn. She is one of our nurses in the burn center. And Benita, would you like to say hello?
Hello. Glad to be
Right.
here.
We also have with us Chris Marshall. He is one of our nurse educators in the Burn Center, and he's also instrumental in helping teach the staff and the incoming staff issues and ways that we manage the burn patients. And Chris, you'd like to say hello?
Hello, everybody, and thank you for joining us today.
Thanks. So first, we'd like to discuss the burns and how they happen. So in the Burn Center here at Stony Brook, which has been in place since 1982, started by Dr. Harry Soroff, he had started the Burn Center here in Suffolk County because there was no other facility to manage these critically ill patients, both adult and pediatrics. So what we've done is we've continued his dream and his vision in the Burn Center. And at this point, we manage both adult and pediatric burns for all of Suffolk County. We manage pediatric burns for pretty much all of Long Island. And we admit about 250 patients per year. We see about 700 as clinic and also as ER visitation. So we're a pretty busy center. We have an 8-bedded unit. And one of the things that we'd like to do is provide a service like this to discuss with people, any questions that they have about burns. So what are burns? Burns themselves is any thermal injury to skin, but it can also include things like frostbite. It can include things like chemical burns, even radiation burns through medical treatments for malignancies. So any alteration to the skin, the largest organ in the body, is what we treat. And this time of year, we're seeing a lot of frostbite injuries, so it's part of what we do and what we take care of. Now, the pediatric burns, we're the only specialized pediatric center for burns in Suffolk County, and the people that you've met and myself are the ones that are instrumental in helping care for these children. We also see them in the outpatient setting, and I think that what we want to provide today is a way for people to call in with questions and be able to discuss questions and answers about what they may want to know about burns. So again, back to the Burn Center itself. We're an 8-bedded burn unit. It's been here since 1982. The patients that are seen in the ER that may be transferred from all over Long Island. We even get transfers from outside Long Island also, or people who may have been traveling or vacationing and they're in another center, another hospital, and another state, and they'd be transferred back to us for the specialized burn care that we can provide. And once here, the patients will be seen by myself and then admitted to the burn unit. And one of the things that is important to realize is that just because they get diagnosed with a burn, that's one aspect of the care. And I think that what next comes is very important is the nursing care. The nursing care of a burn patient is very important, and it's really the linchpin that actually provides a good outcome. So if you have good nursing care, you have the best outcome possible. And I'd like to see if Benita, you'd like to chime in about the nursing experience at the bedside, and what you see and how the nurses are really, again, in my opinion, the nurses are instrumental in really getting us the best outcome. So I don't know if you're able to chime in.
Sure. Um, the first thing you're going to see when the patient enter the burn center, the first thing you're going to feel is compassion. And all the nurses in the burn center, they exhibit lots of compassion for the patients. When the patient first walk through the door, or either they're rolled into the door on a stretcher, they're immediately taken to our shower room. And in the shower room, we clean the patients that's been burned, making sure that they're nice and clean. And then we take them to our treatment room where treatment is performed. And during all of this process, we're constantly, providing reassurance to them. We're explaining to them exactly what we're going to do and why. And at the same time, we're also trying to monitor their anxiety and their pain. And also, while doing the burn dressings, it's very important for the nurses to do the dressings in a way that is going to allow them optimal mobility and able to take care of themselves as much as possible. um, Education throughout their whole treatment is something that we really stress with the patients, because we want to, from the minute they walk through the door, we want to educate them enough so they'll be able to to go home and and do as much for themselves as possible. And the nurses on the burn unit, they are excellent in what they do. um, and that's what I wanted to say about that.
Well, Benita, you really hit that right on the head there, and that was really the excellent response, and I think the caring, because again, we're dealing with a very sensitive population that is, in distress. They may have lost their homes, they may have lost loved ones, and they're in a very fragile situation, and we try to remain attuned to that. And the nurses at the bedside are the ones that are going to be with you that entire hospital course, and they'll be the ones to when you're experiencing these anxieties and the stresses related to not just your injury, but to what else is happening into your life, because burns are just not the event itself. There's a lot that you carry with you, emotionally too, and I think that the burn nursing staff is particularly attuned to that. And this is a staff that is there in the burn unit, doing what they do best, and caring for these patients. And I think one of the things that we do also in our burn center is we're very in tune with education, and how education really results in good patient outcome. And uh, Chris, if you'd like to, Stephen, Chris Marshall, if you'd like to, respond to, what we think about and how important education is for the care of the burn patient.
Sure. Thanks, Dr. Sandoval. Yeah, I've always said to be a good burn nurse, you have to be a good teacher as well. We do a lot of education regarding wound care. We also teach the patients a lot about what to expect as they heal, and which can be a lengthy process for a lot of these patients, can go on for weeks or months, depending on the injury. So, we like to start with the basics, which is like, how is your loved one going to be able to care for you when you return to your home? If they are returning home, maybe they're going to um, another residence, if their home has been destroyed. So the families will come in a lot of times, and we'll do a hands-on demonstration where the nurse will actually physically guide the loved one or the caregiver through the process, and they get their hands into the burn dressings and really learn how to do it with our guidance. We use a teach back method, which seems to work really well for most of the patients. And that is pretty much first step. After that, we always make ourselves available. We Upon discharge, we always give the patients the number for the desk. We like to say that someone's going to answer that phone 24 hours a day, 7 days a week, 365 days a year. Have you any questions? We're happy to help.
Thank you, Chris. I think the burn nurse is probably one of the most educated nurses in the entire hospital system. They're constantly advancing their craft. They are put up against nurses nationwide, For their knowledge base, they go to international conferences to advance their craft. And that's something that really sets them apart from just other nursing staff, is that there is this educational component to burn care, that just what's done today may be something to advance upon at a conference, and to really compare what is done here as opposed to other facilities. Again, once the patient gets through the hospitalization, then one of the things I want to get to is talking about what we do in the clinic setting. And the clinic setting is very important too. And again, with all the patients that we see, we actually see a tremendous amount in the clinic. Last year we had about 1,700 clinic visits. Some of those were repeat patients, some of them are just follow up, but still a tremendous amount of patients in that setting. And I'd like to, see if Norman can speak to the, to the clinic setting, and what he sees and what the patient can experience in the clinic setting.
Yeah, so I work at multiple locations. I do work in urgent cares for adult and pediatric centers, and then I work in the burn clinic here at Stony Brook as my full-time job. But point being is coming across a lot of different working in emergency rooms, working in urgent cares, because there's a lot of different healthcare professionals who treat burns, and you can go to a few different doctors and have different treatments. It's very important to make sure that you follow up with a burn center, even if it's a small burn. The burns over the joints are definitely more important than other areas, or burns on the face. You want to make sure that it prevents any type of future inhibition or movement of that joint. And sometimes what the doctors treat you with in the emergency department or at the urgent cares may not be the same treatment that the burn specialist would recommend. So, excuse me. So no matter what region that you live in, it's always very important for those doctors or healthcare professionals to reach out to their burn center, find out what type of treatments they're using, so they can have the appropriate treatment right from the first evaluation of this burn. And when they follow up with the burn center, then that continuation of care can be taken care of right away. A lot of people are under different ideas in regards to, we hear about home remedies such as putting eggs or butter on burns. We hear about different types of treatments like cleaning it with hydrogen peroxide, which can be too caustic to the new cells that are trying to grow in. So once the patients are trying to clean with hydrogen peroxide on a daily basis, those new cells that are trying to grow in and heal, you're now killing those healthy cells with hydrogen peroxide. So all these different forms of cleaning and treatments for the burns from emergency departments and urgent cares ultimately can delay healing if they don't communicate or are not on the same page with the burn specialist in that area. So in regards to the outpatient treatments, a lot of times also we see burns from primary care doctors, we see burns from urgent cares, and not everyone goes straight to the emergency room with a burn. If it's a smaller burn, sometimes the pediatrician will call our office for an appointment to be seen within a day or so. And we'll try to get them into the burn unit so that we can surpass the emergency department. Unless someone's in a fair amount of pain, we usually do try to treat the patient as an outpatient instead of having them go to the emergency room. Of course, if someone seems that like it's a significant burn and it's a large burn and the person is in a lot of pain, we do suggest sending them to the emergency department for pain control and for possible admission for appropriate cleaning of those burns. So just from an outpatient perspective, we see such a wide variety of initiation of treatments. We see a wide variety of how to clean those wounds. And sometimes we're seeing patients 2 or 3 weeks out from their burn, and it can delay the ultimate treatment or the healing of those wounds. So those are just some of the ideas in regards to the outpatient treatments. Now, once we get these wounds healed, we do keep an eye out for scarring. We do keep an eye out for any types of further treatments that need to be done down the road. And we see a fair amount of different types of burns, whether it be chemical burns, steam burns, thermal burns, scald burns, frostbite burns, like Dr. Sandoval said earlier in the discussion. Just making sure that those outpatient treatments are, like I said, initiated and referred to a burn unit is very important at that time.
Thanks, Norm. That was great. I mean, the interesting thing is a lot of the home remedies are, we try not to encourage them. The interesting thing is some of the home remedies, such as honey, some of those things have actually borne fruit, you might say, over the last couple of decades. But the problem is that that's after peer review and a lot of other educational advancements. So there's some basis on some of these things. The problem is when you have too many chefs in the kitchen, people are trying to get these burns treated acutely. It's better to contact a specialist to see what the state of the art is and what the current medical dogma is. And we have a question that comes up, is that a burn victim most likely comes to the emergency department first? As Norm mentioned, a burn patient can be directly seen through a pediatrician's office and get sent over. But when they do go to the ER, sometimes we get called ahead of time that such a patient's at a outside hospital and they're being seen for a burn there. What's the indication for transfer? Well, the American Burn Association has some, about 10 different qualifications for why a patient needs to be transferred to a burn center. Be a pediatric patient, whether it be a burn injury on an area of the body that can't be managed at that facility, and third-degree burns of any size. If there's an associated trauma, because burn centers are most likely associated with a trauma center. In the United States, there's only 126 burn centers that exist, and all the burn centers that exist do have a trauma center in association with them. So, it's so a patient going through the ER, the burn center may be involved before the patient even gets here. And that's usually the most efficient means of communication is when the patient is already on the way in, and so we know about it, so we can really mobilize the troops and get everyone involved and have everyone from the burn center there. Also, we work well with the anesthesiologists, the trauma surgeons and things like that, because sometimes burns happen, not by themselves. Sometimes it happens in conjunction with a car accident or, again, some other form of trauma. It may occur in a patient who is, who's pregnant, or something else happening at the same time. So burns are never in absentia. They're in, there's something else happening at the same time. And it's important that we remain in communication. One of the people we remain in communication with is the Suffolk County Volunteer Firefighter Service. There's a reason why the burn center itself is the Suffolk County Volunteer Firefighters Burn Center, is because we work very closely with them. They're on the front lines of these house fires and other industrial fires and things like that. Even electrical injuries and work-related injuries. And sometimes they're the first emergency responders, and they're there, extricating these people from, potentially fatal situations, and being the first in line to really, prevent further injury. And so I really can't, express enough how important they are also. Some of the questions that people ask, I think we addressed before. What is a burn and what can cause a burn? And I think that I want to refer back to Norm again, if you want to just field that question about what is a burn and what causes a burn. You already mentioned some things about a burn, but if you want to if you can field that question, that question about what is a burn in general and what causes it. So if Norm, you want to just field that one for a sec.
Yeah, so a burn in general is any type of damage to the dermis or subdermis of the skin. We do have multiple layers of skin, and depending on those injuries can determine the depth of the burn. A lot of times flash burns will kind of crisp the top of the skin and get more superficial. Sometimes chemical burns can be more caustic and it can eat away at the skin and go down multiple levels. So even almost 12 or 24 hours or a day after the injury of a chemical burn, it will continue to eat away at the underlying tissue and the skin and go down to the muscle or tendon. So burns, as Dr. Sandoval mentioned in the beginning of the program, is any type of damage or injury to the skin. And it goes through multiple layers of skin and even into the muscle, into the soft tissue of the skin, into the tendons. And basically, those injuries can sometimes initially we see them in the emergency department and say, oh, it's a first-degree burn. But then over 6 to 12 hours, the extra damage to the skin can occur. So sometimes emergency departments or the initial evaluator will say it's maybe a first or a superficial second-degree burn. But then as time goes on, you'll see that there's more damage down the line because we're continuously monitoring it. We're changing the dressings a few times a day, and those injuries can become more deep than what they were initially, which is why it's so important to make sure that they're monitoring and changing the dressings in the burn center. So then they can determine when they would need to have surgical intervention and debridement and potentially skin grafts. Dr. Sandoval and the inpatient nurses definitely will be monitoring that. If you want to touch back on base in regards to the inpatient treatment, Dr. Sandoval or Chris or.
Thanks, Norm. So it's right. There's multiple different ways that burns can occur. As Norm was mentioning, and we discussing things even about frostbite this time of year. We've had a real uptick, over the last week or so, with the weather being as brutally cold as it is. The exposure, exposure, frostbite, same. It's really a devastating injury. Some of the things that we see is that it affects those most at risk, the elderly and children too. Kids get out there and they forget about everything and they just want to play in the snow. So one of the things that happens is is there any difference in the care that we provide for children versus adults? And when they're in the hospital, it's again, as I mentioned, the nursing at the bedside, the nurses are the ones that really, have to deal on the minute-to-minute needs of the patient. And, if Benita, you can speak to, what, the differences or the experiences in the pediatric versus adult burn patient, and how are they different and the experiences of caring for an adult versus a pediatric patient in the hospital.
Sure. Pediatric, there's definitely a difference in caring for the pediatric and the adult patients. Pediatric patients, they have thinner skin, and we find that most of our pediatric patients that come in, most of those patients have scald burns. And usually this is Burn Prevention Month. One of the main things is that the little kids, they get into either hot soup or the parents' hot coffee and they spill it on them. So you're going to see a lot of liquid burns with your pediatric patients. And so when you get the pediatric patients, you're not just caring for the patient, you're also caring for the parent, because most likely the parent has a lot of guilt and anxiety because this happened to the little one. The surface area, because the pediatric patients are so much smaller, the surface area is going to be different. So the TBSA may be higher. And with adult patients, we see that a lot of the adult patients are not necessarily scald burns, but they're more burns from flames of some sort. And that's the main difference that I see with the pediatric versus adult patients, the different types of burn. But for the most part, when it comes to caring for doing the wound care for either pediatric or adult, we're pretty much going through the same process. We're constantly, we're cleaning the wound. We're constantly assessing for pain and anxiety, trying to keep them, as mobile as possible, able to do as much as they can for themselves, whether they're adult or whether they're pediatric. But the main difference that I've noticed is probably the type of burns as far as pediatric to adults. Now for pediatrics with the little babies, it's mostly the scald burns. But then as the teenagers or the preteens grow up, then you might start to see a little more of the cooking burns. They're at the stove and, those are the differences that I've seen.
Thanks so much, Benita. We have a question in from Alicia Bettinelli. Is there a time frame for burn treatment? For example, when might it be considered too late to treat a bad burn? It's a good question. I mean, honestly, people think, if you get burned, I mean, what's the time frame? Well, initially, when you get burned, what do you do? I mean, you get yourself out of the situation first and foremost. I think if you're in a burn situation, get yourself out of the situation. If it's a house fire, of course, just get yourself away from that. If it's electrical, whatever it might be, extricate yourself. And if you see someone else getting injured, also just be careful. Try not to be the second victim. So again, you have a bad burn, and then initially, what do you want to do? You want to, if it's a scalding injury or some kind of heat injury, applying cool temperature to the area to kind of cool it down. Getting the area to be just the heat away from the area. For the first 24, 48 hours, there's still changes going on in the burn. So the burn can actually worsen during that time, even though you may be away from the heat, you may be away from the cold, whatever it might be, whatever caused the burn, chemicals, whatever it is, there's still a process of cellular damage going on. So, the sooner you get to a center, or as soon as you get the burn treated, the better your outcome is going to be. I think a bad burn, a bad scald injury, a bad thermal injury, flame, or even frostbite, whatever the cause of the injury, trying to get to be treated and getting the inflammatory process taken care of. So the inflammatory process just doesn't stop as soon as you remove the heat. It's still going on in the cells. And the sooner you get a burn treated, as soon as you take away that cellular damage process by using anti-inflammatories, pain medication, getting the dead tissue off, preventing infection, that's going to give you the best chance of developing a new layer of skin on the area. Now, if it's so deep that you require the removal of the dead skin and a skin graft, then that's a process that can take several days to figure out if you need to do that. And then skin grafting can take weeks to months to heal. And once the healing process occurs, that burn is still at risk for developing thickened scars. Now, that's indicative of a bad burn too. The burn itself, developing thick scars, is something that we actually manage here also. Patients who develop thick scars because of whatever reason they got burned and getting skin grafts, scars can reduce range of function, range of motion. It can really affect somebody's overall livelihood and lifestyle, and cause significant cosmetic and functional deficits. So there's really no bad time to be taken care of a bad burn. But the sooner you get to a center that understands what is needed to mitigate or minimize the inflammatory and thermal processes, the better. But you really, the first 20 minutes, if you want to talk about in terms of if that's what you're asking, the first 20 minutes of really getting the temperature or getting the chemical off of you, that's probably the most. The first 20, 30 minutes, and then getting to the hospital within a couple of hours. The more time you leave that open, exposed tissue to dry out, that's when you get bad outcomes, increased risk of scarring, increased risk of infections. So you really want to be in the first couple of hours like this woman has got a plan to get to a center that can manage this. And if there's an associated something else going on, whether it be a trauma, a car accident, or something else like that, the burns don't take center stage. Sometimes burns can really be so visible and so showing such an impressive response that you don't forget about other things. Like, I've had patients who they get burned at the same time they fell, off of a motorcycle, and the burn really occurred because of road rash, but they also didn't even realize they broke a couple of toes or a couple of fingers, and it's because the burn is so visible to them and to the people around them. So by the time they actually get to a center that's like, this is not just road rash, this is also some broken bones here too. So it's really, the sooner you get the burns addressed, the better the results are going to be. So one of the things also we wanted to talk about is prevention, because that's what this all boils down to. Our whole goal is to not just take care of the burn patient, but to minimize your future burn injuries. And one of the things that I see, if Chris, if you can answer a question about, like, how does someone prevent burns at home, both in the adults and the pediatric population, if you want to field that question, Chris.
Sure thing. Home, like Benita was saying earlier, especially in the pediatric population, The largest risk is going to be your scald burns. So parents and caregivers should be vigilant of the temperature of their water. That would be the primary way to prevent the scald burn at home. So your running water, your water that comes out of your hot faucet, ideally should be set below 120 degrees. That can be done various ways. Sometimes the homeowner can alter it themselves, or sometimes it requires a professional to be called in, especially if you're renting. The landlord might want to be involved in that process. Safety in the kitchen is another big one for preventing scald burns. Just to backtrack for a second, I forgot to touch on bathing children under running water. Please, if parents and caregivers could not bathe children under running water, because the temperature of the water can fluctuate throughout the cycle of the water flowing through. That would reduce greatly the chance of like your child being exposed to a temperature hot enough to cause an injury. Supervision as well. While children are in a bath, they can turn on hot water knobs and get exposed again. In the kitchen, as I was speaking about earlier, just before, it's really them pulling things down. That's generally what I would say is the number one hazard in the kitchen. Hot pots with electrical cords, cups of hot microwave tea placed on top of dish rags, even caregivers holding hot beverages while holding a child. Toddlers and infants are curious creatures, and they'll reach out and they try to grab that cup, and usually results in a scald burn for the children or the infant. Those would be the primary ways for scald prevention. As far as adults, I think probably fire prevention, flame prevention is probably your primary. So you're talking about your smoke detectors is your number one prevention. In that case, you're going to want some early detection so you and your family can get out of the domicile safely and quickly. Not storing flammable liquids and things and such next to heat sources. It kind of seems obvious, but space is limited in a home, and sometimes we do put things that we forget are flammable next to your boiler, under your sink, by an electrical outlet. I don't want to get too far ahead on this topic, but we offer burn prevention as well, and we have a lot of outreach with the firefighters. I don't want to get too far ahead on that, Dr. Sandoval, so I'll throw it back to you.
Well, that's, again, I think you could spend a day just talking about just preventing burns. I think it's, there's with the pediatric population, kids are really just constantly, at odds with not getting injured. And I think, having little kids around there's a recipe, for injury. And one of the things that we find is, bathing is far and away probably the most common reason why the littlest ones get injured. Again, as Chris mentioned, running water is really never happened. I mean, running, you really want to have a bath set for a child, not put them under a faucet, because temperatures can change radically. And then one of the things we found also is that patients who bathe their children in sinks that have like stainless steel sinks, well, the stainless steel stays warmer than like a porcelain sink, and so that metal stays hotter for longer and causes more injuries. And I think that we get a lot of children that they'll play with the faucet and turn on the water, and Norm just chimed in that's one of the things that we see a lot of, and that's true, Norm. Yeah, the children will just reach up to the faucet or kick it or something like that. So you really want to have the bath set before you really start bathing the child. And then even when the kids are, as Chris is mentioning also, he's sending a message that, what about outdoor burn prevention? Well, there's another big one too. Not much of an issue right now except for exposure things. But I tell you, in the summertime, everything from tiki torches to grills and fire pits, especially fire pits, they are an incredibly large source of burn patients every year, and more over the last couple of years. As fire pits become more and more commonplace, they're children just seem to, run around these things, and then they land and putting both hands on the fire pit, and they come in with the blisters, and then what happens even after that, if the fire pit doesn't get them, then when they're emptying out the fire pit and they put it on the ground as they dump it out, the kids are running without shoes, and they just run right into the hot coals of the fire pit. So, they're not to really put the kibosh on everyone's summertime fun, but you just have to do so with the realization that that is one of the things we see also is when you have little kids around, everything you do, it can result in some form of injury. Just a fire pit alone has everything from hot contact burns, flame burns from using some kind of accelerant, the coals. Norm, Norm, if you want to, why don't you have some things you want to talk about this too? Yeah, take over a little bit and talk about this.
Okay. Well, we were talking about the propane, the outdoor injuries for the summertime. And like Dr. Sandoval said, even though we're not really in the summertime, we see a fair amount of propane tank explosions when people are not twisting the propane tank on correctly, and then it explodes. We've seen about 2 or 3 people this summer with propane tank explosions, or the workers who are trying to fill up the propane tanks. The propane tank is kept at a very cold temperature, so when they go to fill the propane tank, some of the gas leaks out and freezes and burns there. They get frostbite burns in the summer from the chemicals of the propane tanks. Seeing a fair amount of, like Chris mentioned, Chris was talking about some tiki torch burns. We've seen a few kids who, when they put the tiki torches in the ground, they're not putting them deep enough in the ground. So if kids are outside at a picnic or a barbecue, and someone walks past or runs past the tiki torch, it'll tip over because it's not in the ground far enough, and it'll tip over, and that oil inside of the tiki torch will then flare out and go and burn anyone in the area. So we've seen a few kids with those tiki torch burns. So making sure that the tiki torch is either in the ground far enough, or also next to some type of outdoor, like a stronger structure that you can maybe zip tie it to prevent it from falling. Those things will definitely benefit kids and adults in the outside setting in the summer. Fire pits, we've seen a lot of people trying to use accelerants with fire pits, with gasoline and the starter fluid for barbecues. So we've seen a lot of people try to use accelerants with fire pits. Pouring gasoline directly on the fire is never ever a safe thing, and it will never end good for anyone. So people pouring the gasoline on fire pits or accelerants on fire pits, just stick with the wood and make sure that you have your stuff underneath the fire pit so that it can just naturally start, instead of trying to add accelerants, and making sure that those chemicals stay away from, or gasoline and accelerants stay away from fire pits. That will definitely help out. Lighter fluid that people spray on there so they can see the flash burn of the fire pit. They think it's really cool until, they accidentally spray it past the fire pit or get it on someone. Or the gasoline, when people try to pour it on there and they have some on their clothing, and the flash burn from the fire pit will go up the clothing and up on their arm. Chris, have you had any educational stuff that you pass out in the summertime, or is there things you do in the summer in regards to educational stuff like that with the volunteer firefighters that you know?
Sure. Thanks, Norman. I wanted to touch on fire pits at the beach, because this is almost like a hidden hazard, and we always get a couple every summer. People like to make fires at the beach, sit and enjoy it. I do it myself. And I think people believe that they're acting in good conscience by burying their fires when they leave in the sand. So they'll cover their remaining embers with sand, thinking that it'll asphyxiate the fire, cut off the O2, and the fire will cool down and be gone by morning. But what happens is you're kind of leaving a trap for the next day's families and beachgoers. They will not see this fire pit because it's covered in what looks to be normal sand, but that sand is actually superheated by these embers all night. So the unfortunate person that steps in that sand gets usually a very significant burn to their foot, or both feet, depending if they're wearing shoes. It can even go inside the shoe, and Crocs are notorious for that. It'll go in through all the little holes. So that's something specific to beach and summertime burn prevention that we do see quite often. Other than that, I mean, I think sparklers maybe during the summertime would be the other one. But to get back to burn prevention, we do a lot of outreach with the firefighters, mainly in October. That seems to be when most of the fire departments like to do their open houses, and they invite the burn center staff to come. And we usually set up a table, and sometimes we're joined by the Suffolk County fire educators, and we do as much burn prevention as people will let us do and listen to. As you can tell now, we can kind of talk about burn prevention for hours. There's just so many different ways that we could prevent these injuries from happening. It's just a matter of keeping on the message and getting it out to the public, and it's a sustained effort.
So yeah, it's interesting that in this field of medicine, burns as a specialty in of itself is one of the few fields in medicine that's its ultimate goal is to make its job not exist anymore. But as long as humans play with fire, or deal with fire, there'll be a need for for what we do. One of the things also is is that chemical burns, and I kind of touched on it a little bit before, but chemical burns really are such a varied field. And chemical burns can be something as dramatic as battery acid on a car, but it could be even simpler things. Around the house, almost every cleaning chemical that we've dealt with, that we've seen, has caused a form of irritation and burns. That it's really impressive, whether it be a drain cleaner, some kind of other soaps cleaners, citrus-based cleaners. I've seen all of these, cause extensive burns, and in the right concentration and the right amount of exposure, we've seen pretty much the litany of chemicals that have caused injuries that have required burn admission and burn treatment. Is we could spend hours just talking about that. We get a lot of industrial injuries too. There's a lot of still some manufacturing facilities on Long Island that use industrial chemicals for cleaning, and so we deal a lot with the people who are at work in an industrial setting, and they get injured from just an occupational exposure to chemicals. The occupational exposures also, run the gamut. People at work people deliver propane, kind of alluding back to what Norman spoke about before. People delivering gasoline, people delivering every type of fuel, every form of electrical work, that can result in electrical injuries too, because electrical injuries produce some of the most highest temperatures, and the amount of injuries that the electrical injuries can provide is just really dramatic and devastating, both in the short and long term. I mean, just surviving the initial injury is only part of the process. The process of multiple months of hospitalization, multiple surgeries, and then trying to really provide return of form and function. And there's Chris just chimed in about what about outlet covers in children. I said it's incredible, like something as simple as that. Anybody on this who's on this site who's listening to us right now as little kids, outlet covers are just so important. Kids just love to stick things in outlets, and electrical injuries that occur with that is devastating. Even electrical cords, kids just pull on these things, and we see a lot of that too. One of the things, I don't know if somebody wants to talk about what we've been seeing with the exercise equipment recently, and some burns here. I think we have a question coming in. We have a question from Barbara Jo Howard. Do severe burns like this increase the risk of cancer in the future? Do you treat severe burns that blister? Yes. Well, do severe burns like this increase risk of cancer in the future? Yes, there is a risk. What's called a Marjolin ulcer. It's actually an increased chance of squamous cell cancer of the skin developing as a result of the chronic irritation, particularly in burns that have been left to heal on their own. These burns that are so large that the healing process takes weeks to months. It's just the chronic overturning of cellular development. At some point, some abnormal cell develops in that area, and it can take decades for it to really manifest itself as, as a form of squamous cell cancer of the skin. It's quite devastating when it does happen. Out of the thousands of, probably tens of thousands of patients I've taken care of, I think I've only run into maybe two of them, but the literature, is still, has as a possibility, for more of a squamous cell. Now, in terms of melanoma, I think there is a associated increase with that. Already, you have skin that is damaged, and then you get the sun exposure, your increased risk of melanoma exists too. It's a bit difficult to extract like how much percentage it worsens it by, but there are, again, so there's two forms of malignancy that increases by, both melanomas, because the skin may have a diminished amount of melanocytes as a result of injury, or just because the chronicity, or how long it took for the burn to heal, increases the risk of your squamous cell cancers. So there's really two forms of malignancy which can occur as a result of burns. And sunburns that blister. Anytime you have blistering, that's essentially a second-degree burn. That top layer, the epidermis, once that's removed, that's a second-degree burn. And second-degree burns are managed by, having a medicated dressing on them, and pain control. A regular first-degree burn, a sunburn, usually closes up from a pink, painful area in about 4 to 7 days. A second-degree burn really doesn't hit its stride until around 7 to 10 days before a new layer of skin develops. Now that it changes as per the age of the patient and the overall health condition of the patient, but that's the usual time frame for somebody who has their first degree burn, which is again sunburn, second degree burn, blistering, more common with fire, flame, and things like that. And a third degree burn is all the layers of skin have died off. And those patients, depending upon the size of that area, may require surgery to remove the dead tissue and apply a skin graft to kind of fill in the gap, you might say. But third-degree burn smaller than about a quarter should heal on its own, but anything larger than that may require surgical intervention. So again, to answer your question, Barbara, is that yes, there's several types of cancers that can be increased as a result of a bad burn, and we would treat any kind of blistering injury from whatever source, whether it be thermal, sun, chemical burns. So let's see. I think one of the things we were talking about also, and we talked about the outlet covers. Is there anything that we were now, Benita? One of the questions I have also for our nursing staff is that what do you want to address to the people that are listening in terms of what you would want to see them understanding about what the burn centers, what our whole mantra is, or what do you think that we are trying to, I think we do a great job, and I think we are such a caring group, but in terms of what do you want people to know about the nursing staff at the burn center? I think you guys are the best, and I know you're such a great caring bunch, and I think you expressed that already. And as we're growing, time's growing shorter for our live stream here. Is there anything else you want to just say from the burn nursing staff?
Sure. I think I speak on behalf of the nursing staff that we find working on the burn unit to be very rewarding. Patients come in with these, bad burns, and it's rewarding to see how they make progress, and that's rewarding to see with the burn patients. The whole while they're here on the unit, it really is like, it's not just the burn nurses that takes care of them. There's a whole lot of other systems that come in place. You have your physical therapist that comes in, the occupational therapist that may need to work with them. You have the child life people that might come in and work with them. There's a whole lot of other systems, psychiatry that may have to come in, and help them, get through this crisis that's going on in their life. There's a whole lot of things that's going on in the burn unit. It's not just the burn care, and you have to constantly be aware of that. You got pain management. I mean, there's so many departments that comes in to assist us with taking care of these patients. And when they leave, it's rewarding to see the progress that they've made, because you you could actually visually see it. And that's what I have.
So, one of the things also, and Chris, in terms of, it's not, as Benita mentioned, it's not just the nurses. There are other groups also that are involved in caring for the burn patients. I don't know if you want to address, who else, has a hand in making the life of the burn patient better, I guess.
Sure. Thanks, Dr. Sandoval. So it's a collection of both private and corporate interests. Sometimes, most recently it was a previous patient who, instead of collecting toys for their son's birthday, they asked everyone to donate toys to the burn unit. So that was a really nice gesture, heartfelt, and just kind of goes to show the connections that we develop with our patients. We also get donations through the New York Fire Alarm Association. They come to us every year for Christmas and drop off usually more toys than we can accommodate. We only have a limited capacity to store these things, but it is greatly appreciated and just kind of furthers our outreach with the community. The firefighters also are a never-ending source of support for us, as well as donations. There are a few things that we are left needing or wanting because of their support. That's just to name a few. There are more people that help out the burn unit and support us.
It does take a village to support a burn patient. Burn care is exceedingly expensive, and it can be a lifetime of just needing equipment, supplies, support. Chris mentioned the firefighters, and they've supported also burn camp for burn kids to be able to spend time in the summers with other children who are burned, sometimes worse than they are, or it's just to be able to see how they can function, and to see kids being kids, and not focusing on their outward appearance, their outward injury. And that's one of the things that I think I'm most proud of, is that being able to get these kids to just to really not let their burn injury dictate their lives. And that's one of the things that we really focus on in the burn center, is that the burn, it doesn't define you. It's part of your life. It's it's maybe the most stressful part of your life, the most horrible part of your life, but it doesn't define you. It is just, we try to make it just a bump in the road as best we can. And the people who support us, and the people who support, the outcome. And then that's everyone from the nursing staff, the rehab people, the firefighters, the amount of people that are really involved in making sure that the burn patient has a good outcome. That would take up this entire hour of a live stream just to introduce them. It's hundreds of people probably who are responsible for take it upon themselves. They're not responsible. They take it upon themselves to make sure that the burn patient, both pediatric and adult, get the best outcome, that they feel like they've been cared for, that this is not the end of their life. This is just something to move forward. This is something that we want you to realize, that as you come to the burn center, and hopefully we never have to come to the burn center. Hopefully we never meet you, because that's really what all of this is. But if you do need us, you do need help with any form of injury that affects your skin, any traumatic injury to your skin from whatever source. And we're here at the Stony Brook's Suffolk County Volunteer Firefighters Burn Center. The number's up on the screen. And should you ever need our services, and I really hope that you never have to, but if you do, we're here. And I'd like to open this up to anyone else on this live stream, Norm and Chris and Benita. If anybody else has anything else they want to add, we're here for you. So anyone just want to chime in?
I'd just like to say it's a privilege to work with you all. We have a special group of people here, and I look forward to coming to work with you guys every day.
I want to thank you.
So,
I want to thank you all for also doing your part in the hospital. You, Benita, and Steve, Chris, sorry, and Dr. Sandoval. I feel like we work well as a team, and it's all for the patients and for the family members. Education for the family to take care of the wounds appropriately. Education when they get into the door, and appropriate care so that the burn outcomes will be to the maximum or to the best of their ability, so that the wounds can be healed and the patient can get back to their baseline and back to the best that they can be in regards to their health.
I just want to say, working in the burn center is very rewarding, and it's something that it takes a special type of person to do, because not everybody can do it. But we have a good crew down here, and hopefully we never have to see any new faces there. But if you do, you'll be in good hands.
I'd like to thank everybody who sent in some questions. It's very much appreciated. We do this because we care, but it's nice to know that people are out there that listen to us, and the telephone number that we had up on the screen for the burn center. We can answer some questions there too, and if you want to be seen, even burns that are decades old. If there's something that, there are things we can do to help. If burns still affect your life, and even if it's happened a week ago, a month ago, 50 years ago, if they're still affecting you, then we're here, and we may be able to help you, and I think we can. So thank you for sending your questions. I really do appreciate it. So thank you to Alicia, thank you to Barbara, and numbers up if any questions. So.